And hello to you on this Wednesday. Quebec has become the first province in the country to allow certain people to be approved for medical assistance in dying months or years in advance. Some people see this development as progress, but others disagree. Vanessa Lee explains.
Sandra de Montigny is losing her memory and says she doesn't want to lose her dignity. She was diagnosed with early onset Alzheimer's 6 years ago at the age of 39. She had already watched as the disease slowly ravaged her father, eventually taking his life.
And it's where that I decided that if one day I have the same disease, I would want to terminate my life before the symptoms are too strong.
The Quebec mother of three has been fighting for years for the ability to make an advance request for medical assistance in dying.
It's about my physical autonomy and my behavior too.
Until now, Quebec patients had to give consent immediately before receiving the procedure. It's become the first province to allow a person with a serious and incurable illness to be approved for MAID months or years before they lose the capacity to make medical decisions for themselves. Some health professionals are opposed, arguing it's not informed consent.
You don't have the information. You're looking at your situation now, your views now. But when you become incompetent, incapable of making decisions, well, the situation will be different. Your views might be different. You might be happy.
Advance requests for MAID are still illegal under federal law, but Ottawa says it will not challenge Quebec's move. It will launch a countrywide consultation before amending the criminal code. Health Minister Mark Holland knows firsthand it's a sensitive issue. He saw his grandmother deteriorate as her Alzheimer's progressed.
That was deeply painful for our family. And so I think we need time for a conversation about those kinds of issues and how we want to deal with them as a country.
Here in Quebec, advance requests won't be granted automatically. Patients will have to meet with doctors on multiple occasions, with each case assessed on an individual basis. Vanessa Lee, CBC News, Montreal.
You heard my next guest in Vanessa's report there. Dr. Catherine Ferrier calls advance requests inhumane and a terrible idea. Dr. Ferrier is a physician in the Division of Geriatric Medicine at McGill University Health Centre. She joins me tonight from Montreal. Dr. Ferrier, thanks for being here.
My pleasure.
Why is this a terrible idea?
Well, I've been looking after people with Alzheimer's and other types of dementia for 40 years. Nobody has ever asked for MAID. There are many other ways of looking after people and easing their suffering and making sure that they're safe to the end of their life. And what I see across the country is that there are all kinds of red flags about what's happening with MAID already. In Quebec, the numbers keep going up, and to the point that the government is launching a research project to see why it's so high. We have the highest rate in the world. The Ontario coroner just released a report a couple of weeks ago saying that that marginalized populations were more likely to access MAID not at the end of life than other people, and it seemed to be triggered by poverty, isolation, unstable housing, and so on. So I don't know why there's this urgency to expand MAID to more and more populations when we could do it as we've always done and looked after people, caring for them. That's what people need.
So who do you think that this will disproportionately affect?
Well, if we talk about my patients, it's people who have memory problems that have neurocognitive disorders, dementia. It deteriorates over time. So you receive the diagnosis, and then of course, you're frightened. Everybody's frightened. Nobody wants to have dementia, but most of my patients adapt quite well, very well, and things are not nearly as tragic as we hear. But the idea that you can program your own death, I can see people feeling almost obliged to do that, to spare their families from having to look after them. I can see people consenting without really understanding what they're consenting to.
Let me stop you there, because I want to talk to you about that issue that you just raised, consent. Yeah. And when it comes to being capable of consent, how is it determined who is capable and who is not capable?
All right, so I assess capacity all the time for other kinds of decisions. So medical decisions, housing decisions, financial management. So it's an exercise that we do, that we walk through decisions with the patient. It's very extensive, it's very detailed, and we can determine whether they have a rational capacity to make decisions. The problem with deciding about your death in the future is that you don't have all of the knowledge you need. Free and informed consent in medicine means that you have the data to be able to make a free and reasoned decision. And in advanced requests for MAID, you don't have that because you don't know how things will be. You don't know whether you'll be suffering or not. There's many, many things you don't know. You don't know what the alternatives will be. Maybe you have good care. Maybe there will be new treatments by then for dementia. There are too many unknowns. And then down the road, it's not you making the decision. It's going to be a third party making the decision.
Let me ask you about this. In 2021, a nonpartisan committee recommended that adults in Quebec diagnosed with incurable and incapacitating diseases be able to make advance requests for MAID prior to becoming incapacitated by their illness. Is this not enough evidence to support this idea?
I read the report of that committee, and it was nonpartisan in the sense of political parties, but I don't think it was unbiased in the sense of looking at all of the options around this question.
How do you think policy should approach these issues? And what policy do you think would be more sound in dealing with these issues of consent and advanced consent, in your opinion?
Well, we use advanced consent for refusing certain procedures, right? So saying I don't want to be in ICU if I have end-stage lung disease. I don't want to have resuscitation attempted if my heart stops. But that's always consent. It's consent to not do something to extend your life. So this is a huge leap to consent to actually actively end your life. That's almost unheard of in the world. There are only a few countries where it happens. Where it happens, it's very infrequent because of all of the ethical problems. And so we talk as if this is like a normal development of what we've done up until now, but it's really not. It's a huge, huge leap. And I actually don't think that it's possible to consent to that in advance in keeping with the ethical standards that we've always had in medicine.
Dr. Ferrier, we have to leave it there for now. This is a complex conversation. There are passionate opinions on both sides, but we certainly appreciate your perspective on this tonight. That is Dr. Catherine Ferrier, a physician in the Division of Geriatric Medicine at McGill University Health Centre, joining us from Montreal.